Now, in the 2 years since I've been here, I've reviewed all of the community health needs assessments for the last 12 years. The number one issue that our community has been asking for over a dozen years is access to health care. And the question has to be asked, since Greater Lawrence Family Health Center is a community health center, we see over 250,000 visits a year. How is it that we have a problem with access to care? We're very good at chronic care for diabetes, for hypertension, for childhood wellness visits and prenatal. What we're not so good for is in the moment, when you wake up with a headache, or when your child wakes up with a stomach ache. People are waiting 3 to 4 hours sometimes to be squeezed in our visits, or end up going to the emergency room. We have to change that.
The DyeWorks project is a 35,000 square foot historic building right in the core of the Mill District. And it has been part of the LCW portfolio for many years, since 2006, and is finally teeing up for redevelopment. And so this is a $22 million project to restore the DyeWorks building and to include in that building a center for the Greater Lawrence Family Health Center with a full-service pharmacy, with 9 exam rooms, and with opportunity for community-based services that the health center wants to offer.
So the new DyeWorks project is going to be a wonderful site for patients to be able to enter our healthcare system here at Greater Lawrence Family Health Center. People will be able to walk in and get an appointment, and we know that we have many new patients all the time. So we really want to provide a space for new patients to be able to come in.
And our original conversation with the health center went from having 1,200 square feet of pharmacy space in the building to now having over 7,000 square feet of space doing nutritional health services and behavioral health services and preventive care and some urgent care. And we're so excited about that because we feel like having the health center and the supermarket and Movement City co-located in the building is just going to be wonderful.
Our patients have been telling us for years how they want to receive care. We're actually starting to basically create that open access that the patients have desired. And I think that is the key message. We're basically meeting the patient where the patient wants to be met. And we'll be delivering care in a manner that the patient wants to receive it. I can't think of any clearer message to a funder as far as what the real criticality and need, because in doing that, in effect, we can do better education to the patient, we can do better preventative care, and what's the meaning? What are we really trying to do all this? We're trying to give these patients better lives.
We want your help in closing the gap. We have already raised $1.1 million towards the $1.4 million needed to do this project. With your help, we can finally address the need that the community has been asking for over a dozen years. Help us close the gap. Thank you very much.